Okay, so I am going to check the records to see if my patient has a order for a Foley catheter. She does, so I'm going to gather my equipment, grabbing my Foley catheter tray. I'm inspecting it for expiration, any openings, anything that can make it unsterile. I'm going to go to my patient's room, knock, 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 introduce myself. Hi, I'm Tessa, I'll be your nurse today. I'm going to be inserting Foley cath. I'm going to perform hand hygiene, have her identify her name and birthday. Okay, it matches. I'm going to explain what I'm going to be doing. So I'm going to be giving you a catheter. It's going to be a little bit of pressure, be nice and easy. I'm going to raise the bed, put down the railing, make sure that the door is closed and that she has privacy. And then I'm going to ask her, is it okay if I pull back the blanket? She says yes, so I pull it back. I did provide peri-care before this. And then I'm going to get a little towel. I'm going to put it underneath her just to make sure that her blankets don't get wet or anything. We want to just tuck that underneath. Now I'm going to wash my hands again. I'm going to open my packaging. I've already checked to make sure there's no breaks in it or it wasn't expired. So to open it, I'm going to open away to the sides and then to me. I'm going to grab my gloves, bring it away from there. I'm going to open up and make sure that I don't touch the 1 inch perimeter. Then I'm going to grab with my 2 pinch, lift it up, make sure that I don't touch the inside or the outside of the glove. Then I'm going to scoop and lift and put my gloves on. Okay, now I can fix it. Pull this down all the way. I'm going to throw it away to get it out of the way. And then I'm going to, we don't need this one by policy orders. I'm going to open this up gently without shaking or anything. I'm going to fold it over and pull back. Then I'm going to open the next one to extend my sterile field to give me maximal space. Extending that out. Now that it's all there, I'm going to transfer my box over and then get everything ready. So we don't need that, so we'll throw that away. I'm going to open up my iodine, cover all my cotton balls. I'm going to open my lube, have that all ready in here. Discard that. I'm going to take the wrapper off my catheter, and then I'm going to attach this so whenever it's time, it's already there. So now everything's ready. I'm going to spread with my non-dominant hand. I'm going to inspect the area, get my landmarks all ready, visualize. Going to take a cotton ball, gonna clean top to back, discard on one side, clean the other side, discard, and then clean through the middle, discard. So now we're ready to insert the Foley. So we're gonna lube it all up. We're going to insert until we get a flash of urine. Oh, there's a flash. Our policy doesn't have us insert any extra after that. So I'm going to fill up the balloon. Make sure it stays in place. Once it's in, then I can release and remove. Now I'm going to take that out. I'm going to tape it to her leg to make sure it doesn't pull or tug. I'm going to hang this on the side of the bed. then it's hanging. And then I'm gonna give her all my stuff, so that's taped to her leg. It's all attached, it's not gonna come out. Then I'm going to get all my stuff out of the field and throw it into the trash, everything like that. Take my gloves off, perform hand hygiene. I'm gonna document how she took the procedure, what time I did, all of that stuff. Cover her back up, put her down, give her her call light after she's comfortable. And then now, it's been a little bit later, now we need a specimen. If they wanted the specimen at first, we could have collected it straight from the bag since it was a first time thing, but let's say that they wanted it like, they just put an order in for her. So what we would do is we would clamp the tube for we'd come back about 30 minutes later, she didn't have any urine in the tubing. Then we would get our, depending on the port, so I did hand hygiene, I put new gloves on. This port is a needle one, but I'm not going to use an actual needle. And then I'm going to use the port. It's been 30 minutes, she has urine in there. Put it in there, I'm going to withdraw the needed amount, depending on what kind of testing they're doing, anywhere from 3 to 10 milliliters. And then I'm going to open up the little specimen container, making sure that this doesn't touch the inside or anything. So I'm going to put all that in there. I'll put that all in there. And make sure nothing touches the inside of the lid or the container. Close it up. I'm going to put my name, her name, the date, the time, if it has a specific test, room number, and then my initials or any special instructions. I'm going to take that straight to the room, the laboratory. If not, I can refrigerate it. And then all that's done, I'm going to give her back everything, perform hand hygiene, document that. And then later in the day, the next day, now she needs it removed. So I'm going to introduce myself, check all that stuff, raise her up, perform hand hygiene, and then tell her I'm going to be taking out your catheter. Be real nice and easy. So ask her if I can lift up her blanket, lift it back up. I'm going to get a tissue, and I'm going to make sure that the bag is empty. I inspect the urine, make sure it's not foul odor, cloudy, the color is normal, everything like that. Make sure it's all empty. Unconnect it from the bed, untape it from her leg, and then I'm going to have a tissue ready so we limit how much anything gets on her bedding. Now it's ready to come out. We're gonna let it self project all the water, the solution in the balloon. And it's done, so you're just gonna pull back just a little more to make sure you got it all. And now we're going to take this, and can I get you to bear down, just breathe, and pull it out gently. Inspect it, make sure it's all intact. It is. Wrap it up, throw it all away, cover her back up, document when we took it out, how she handled it, if anything was abnormal. After I've taken off my gloves, perform hand hygiene, put her back down, give her call light, and make everything comfortable.